Good evening all. Good evening. Hey everybody, good evening. Good evening everybody. Good evening. Am I audible, all of you? Am I visible? And then we'll start the discussion of the May exam. Hi everyone. Am I audible? Am I visible? Good evening. You can type something in the chat box, how your exam was, how was pediatrics. Hi everyone, I'll just type in the chat box. Hi, good evening. So how was pediatrics? And how was your INICET exam? That we need to stick to the basics, and the PYQs are very important. So it's not just about the previous year questions, it's about the previous year topics also. So what comes in your exam is very commonly from the previous year topics. So you all need to concentrate on the previous year topics for sure. So whatever we discuss in the classes are important topics, and these are important PYQs as well. So you need to stick to the basics. Don't go to something very new which is in your exam. So these were very common questions, very common topics which came in your exam. So if you talk about pediatrics, it was all, we were very aware that these were the common questions which will come in your exams. We knew about neonatal resuscitation. In every DBT, in your every class, we talked about resuscitation. So a question came on meconium stain liquor. We talked about Kawasaki disease, Hinault-Schönlein purpura. So these are very common topics. So this was nothing unexpected. These were common questions which always come in your exam. So let us start with the first question, and you guys can tell me if the options which I'm telling you are right or wrong. So there was a match the following of some genetic disorders, and what I've done is I have correctly matched them. So in your every pediatrics class, trisomy 18 and trisomy 13. So every class of yours had a question on Edward syndrome or Patau syndrome. We always discuss in all of our genetic lectures. Okay, moving on to the next question. So there were almost 15 questions from pediatrics, and I'll be discussing all of them. Let me know if there is something which was not in your exam or something which I did not discuss. So let's take you to the next question. The next question was a very important question on vaccination, and a very justified question. That this question is on a child who got DPT vaccine at 6 weeks. So this child got DPT vaccine at 6 weeks. And is now 10 weeks old. Now this child is 10 weeks old. Now in the last vaccine, this child got a fever 40.5 degrees and he got severe inconsolable cry. Severe inconsolable cry. Okay. So what should be done at 10 weeks of life? So my question to all of you is, what should be done in this child at this time? Shall I give him DT vaccine? Shall we give him DPT vaccine? DPT should not be given, or we schedule it for next month. So all of you, that the OP Gyne textbook, or whether it's the IIP immunization, all the immunization textbooks, every book says that we know that there is a very important side effect of DPT vaccine. A very rare side effect but important side effect called HHE, hypotonic hyporesponsive episodes. Severe inconsolable cry can happen after DPT vaccine, seizures, encephalopathy. So please listen to me carefully. Absolute contraindication to DPT vaccine is anaphylaxis after the previous dose or encephalopathy within 7 days of the previous dose. So anaphylaxis after previous dose, encephalopathy within the last 7 days. Now, we do not give, and we discuss in all of our classes that we do not give DPT vaccine in progressive neurological disease. So in progressive neurological disease, we give DT or T, low dose diphtheria. Now, whatever was mentioned in this question, fever more than 40.5 degrees within 48 hours, hypotonic hyperresponsive episodes, persistent inconsolable cry for more than 3 hours within the 48 hours of the vaccine, or seizure less than 72 hours. So these are all precautions. Okay, so they're not contraindications. So the answer to this question, everyone, is that we will give the DPT vaccine as scheduled because these are precautions. They do not happen again and they do not cause neurological sequelae. So they do not happen again and they do not cause neurological sequelae. Okay, so we'll give DPT vaccine as usual. Okay, guys. Okay, can we move on to the next question? Let's move on to the next question. Let's move on to the next question. And I can hear myself. My sound is coming fine on the YouTube. Let's take you to the next question. Now, the next question was, and we always told you, then you should remember, even for your NEETPG, dehydration is very important topic. How do you classify dehydration? How do we treat dehydration? So an 18-month-old child comes with diarrhea, vomiting since last 3 days. And guys, you can tell me if any of the option I'm telling you is wrong, was not exactly asked in your exam. Now this child was hypotensive and unresponsive. Okay, so they asked what are the differentials if a child is unresponsive after diarrhea dehydration, and it was a multiple options correct option. Hyponatremia, severe dehydration, HUS, or cerebral venous occlusion. So remember dysnatremias, hypo or hypernatremia can cause unresponsiveness. Severe dehydration, I discussed with all of you, can cause unresponsiveness. Cerebral venous occlusion, of course, sagittal sinus thrombosis in the brain, in the veins, can cause unresponsiveness. So all of you should know that even in the current OPGY textbook has a very nice, simple 5 sentences on this. They're on convulsions. So convulsions and altered sensorium with diarrhea can happen because of dysnatremias, hypoglycemia, okay, encephalitis, meningitis, seizures, or thrombosis. Okay, so hypocalcemia will only cause a seizure, it will not cause altered sensorium. Okay, so this clearly shows that the answer to this question was dysnatremias, venous thrombosis, dehydration. Remember, HUS is a cause of kidney failure, and today I'll discuss with you about kidney failure because this is a very common passion of your examiners also. HUS does not cause altered sensorium usually. HUS is a cause of kidney failure, hemolytic anemia, and thrombocytopenia. So HUS is a triad of microangiopathic hemolytic anemia, thrombocytopenia, and acute kidney injury. Okay. So rest are causes of unresponsiveness. Let's go to the next question, a simple question. Which enzyme is deficient in pompase? So lysosomal acid alpha glucosidase. This is important because all of you, whether you go for INICET exam or you go for NEETPG, you should know that there are some new gene therapies and enzyme therapies. So you should know that there will be definitely a question on SMA, a spinal muscular atrophy, because the gene therapy is revolutionary. It has been successful recently. SMA is important for gene therapy. Enzyme therapy. So enzyme replacement is available. This enzyme is commercially available for Pompe's. So Pompe's, hurlers, hunters, gauchers. They are very important because enzyme replacement therapy is available for Pompe's, hurlers, hunters, Fabry's. Okay, so you should know enzyme replacement therapy, gene therapy, and which disorders this is successful. Now, there was a simple case of a child. They showed a photograph in this exam, and many students told me that this was the exact photograph which came in your exam of a child with slap cheek appearance. And they asked, what complication can this child have? And I have discussed with multiple students, and most of them have told me these were the exact 4 options. So this is erythema infectiosum, 5th disease. Erythema infectiosum, 5th disease, caused by parvovirus B19. This is caused by parvovirus B19. Okay, which causes pure red cell aplasia. Okay, so parvovirus B19 can cause pure red cell aplasia, number 1. Number 2, in the same exam, there was another question. I am not showing you that question, but in the same exam, there was another question on non-immune hydrops fetalis. Non-immune hydrops fetalis. So parvovirus can also cause in pregnant ladies non-immune hydrops fetalis. Remember that. Now there was a question on what screening, especially in a mosaic turners, deafness. So the recurrent otitis media causing conductive deafness, as well as sensory neural hearing loss. So mosaics can, but ANA is not at all needed in Turner syndrome. Remember, Klinefelter syndrome is known to have autoimmune disorders like SLE, Klinefelter syndrome, because Klinefelter can have autoimmune disorders. Okay, they can have autoimmune disorders like lupus and rheumatoid arthritis, not in Turner. Turner thyroid function test will be important. Okay, they have